and do some research and find out what your options are, because maybe it's not as difficult as you think. Maybe.
Absolutely. Always good idea to trust your brain to find out answers for you. So right now we are back with Leslie Ring-Adams, who is a doctor of Chinese medicine, and you're preparing Jenny for
You said I need
treatment?
to be brave. I don't think I need to be brave. I've had this done on my ear before.
Well, there you go. So there's no bravery involved at all. So at any rate, we when it comes to this, how do you start? What are you going to do?
Well, we would look at her whole system and figure out what sort of imbalances we'd have. And points that we would pick for you, we might pick different points for someone else based on what the problem is.
Mm-hmm.
So I'm just going to do a couple points that we would potentially use in practice.
Okay.
So acupuncture really doesn't hurt. It shouldn't hurt. You might feel a bit of a pinprick or a poke, but it shouldn't be uncomfortable. It's not like giving yourself your own injections.
I know when I had it done in my ear before, I felt so relaxed after. I felt like I just had like a 2-hour massage. It was unbelievable.
So now the points that you're using right now on Jenny's arm, is there any specific thinking or theory as to why these spots are going to help?
Well, they run along the meridian that might be influenced or causing some potential imbalances with the meridian that would affect fertility. So we're trying to get that qi and blood flowing, restore the harmony and the balance.
Right. Now, how many needles are you going to insert right now?
I'm going to do 3 right now, but typically most treatments are about 10 to 12 points.
Right.
And then once we get them in, it just takes us a few minutes to get the needles in, and then the patient lies quietly for 20 to 30 minutes. That's the best part of the treatment.
Now, you were telling me earlier that some practitioners of acupuncture actually use electricity?
That's right. So it's just a TENS machine, which commonly is used with physiotherapists or chiropractors, but we would often attach little electrodes or alligator clips to the acupuncture needles, and they just send in a mild stimulus, and we think it's just a bit more aggressive than sticking the needle in.
Do you have one with you?
No, I don't.
Oh, okay. just checking.
Malcolm's trying to get back at me for something.
No. It's just to make you more healthy. But of course, now that I wasn't expecting that one.
I didn't feel that at all. I felt the one in my hand after you put it in, a little kind of spasm, and I didn't feel the elbow.
We'd say that was the qi that you felt. So often it's a feeling of distension or kind of achiness, but typically not painful or uncomfortable.
No, just kind of like, oh, hi.
Yeah. That's qi.
Yeah.
So what's the reaction of doctors who are trained in Western medicine? Do they give you some hassle over this method?
Well, I think from their point of view, they really want to see things that are proven with Western scientific models, and there haven't been enough studies done on acupuncture in regards to fertility. So that's hopefully will change in the years to come. But a lot of the doctors that I work with in Calgary are willing to look at some of the advantages of acupuncture, and one of the big ones we know is that it helps women relax. And I think that is a big factor with trying to get someone pregnant.
Yes, well, Jenny was talking earlier about that rule of stress, and that it's such a connection between stress and so many illnesses. Obviously, the less happy you are, the more anxious you are, it's pretty tough for your body to heal.
Yeah, and the fertility treatments themselves are very stressful, let alone just going through the process of trying to get pregnant.
Yeah. Now, you're a doula, correct? Mm-hmm. Now, some people have never heard that term. It's very exotic. Can you briefly explain what it is?
A doula is a labor and delivery assistant. So there's someone who will attend a birth with the couple as a support person.
Right.
Yeah.
Is it ever done that there should be needles with
Yes, I do acupuncture during the labor and delivery.
Wow. Yeah. Okay, so now that strikes me as a little just because maybe I'm a wimp, but that struck me as a little scary. So, but tell me about that.
Well, there have been some studies showing that acupuncture can help induce someone into labor. So we use it with someone who's several weeks past their due date, and it's also used for pain control and to kind of precipitate labor. So. It doesn't remove, it's not like an epidural where it would actually remove pain, but it can help.
Yeah.
Can I say one thing?
Sure.
I just had a girlfriend who had a baby, and 18 hours of labor, she did not use any sort of pain medicine, even though it hurt, using massage.
Oh,
on the
that's
different,
great.
Yeah, her husband, they learned how to do massage, and that really worked for them.
Yeah,
so that deals with pressure points too, which you're going to be learning about later, and I'll just be quiet now.
Okay, well, we're going to find out more later on, but right now we're going to go to